Hello everyone, I am Nimit Devhan Gonratna from first year second semester group 26. So today in this video I am going to be talking about topic 9 of my nursing surgery practical skills, which is describing and noticing the right side of heart failure. So in the right side heart failure, the heart's right ventricle is too weak or it is not strong enough to pump enough blood to the lungs. As blood builds up in the veins, fluid gets pushed into the tissues in the body, and the right side heart failure symptoms are included swelling and shortness of breath, and treatment focuses on stopping progression of disease and improving systems. So what is actually the right side of the right-sided heart failure? So right-sided heart failure is a type of heart layer in which it is also called right ventricular heart layer, and the right side of your heart pumps used blood from your body back to your lungs where it refuses with oxygen. And right-sided heart failure means your heart right ventricle is too weak to pump enough blood to the lungs. As a result, blood builds up in our veins, vessels that carry blood from the body back to the heart, and this build-up increases pressure in your veins. The pressure then pushes full fluid out of your veins and onto the other tissues, and then fluid builds up in our legs, abdomen or other areas in our body, causing swelling. So how common is a right side heart failure? So each year more than 900,000 people receive a heart failure diagnosis, and heart failure is rare in people younger than 50 years of age. So with age it becomes increasingly common. Studies have shown that around 2 of the world population younger than 54 years of age have heart failure, and the number increases to around 8%, about 1 in 12 people for people over 75 years of age. So what causes right side heart failure? So most right-sided heart failure occurs because of the left side of the heart failure, and this entirely heart gradually weakens, and it is often caused by high blood pressure in the lungs, pulmonary embolism, lung diseases such as chronic obstructive pulmonary disease, or its abbreviation we call it as COPD. So what are the symptoms of right-sided heart failure? So the main symptoms that we have to look out for, which can indicate a right-sided heart failure, is the buildup of blood which leads to swelling or edema in our triangles and lips, lower back, gastrointestinal tract and liver, which causes ascites and other signs. Also include recklessness, chest pain and discomfort, as well as heart palpitations. So when we accumulate, it depends on how much extra fluid in our position. So if we are standing, fluid typically builds up in our legs and feet, and if we are lying down, it builds up in our lower back. If we have a lot of excess fluid, it may even build up in our belly region, and the fluid build up in our liver or stomach may cause nausea, bloating and appetite loss. So once right-sided heart failure becomes advanced, you can also lose weight and muscle mass. So these are also symptoms that we can look out for a high right-sided heart failure. And how is right-sided heart failure diagnosed? So usually right-sided heart failure is diagnosed in our healthcare, where a patient will usually be asked about their symptoms. So often this can be enough. So often this can be enough for a practitioner to determine if it is a right-sided heart failure or not. And then we can also perform a physical exam where our provider or health practitioner will take clear our pulse and blood pressure, as well as listen to our heart and lungs. They will also look for signs of swelling. So among the tests that are needed to diagnose a right-sided heart failure is chest X-ray, electrocardiogram or ECG, echocardiogram, blood tests, especially to measure substances like metriotic pipettes. And to confirm the diagnosis, we will also have to carry out MRI or CT scans, cardiac characterization, stress test, and nuclear exercise stress test. That is all from me today. Those are the ways to notice a right-sided heart. And that's it. And thank you so much for listening.